Hi, thank you, Chair Barrett, Chair Roy, and members of the committee for the opportunity to speak in support of H.3887. My name is Andee Krasner. I'm the Manager of Climate and Health for Greater Boston Physicians for Social Responsibility. GBPSR is a group of nationally recognized experts in public health and medicine whose goal is to raise public awareness about the health impacts of climate change and burning fossil fuels. We support a study to determine the best source of non-emitting energy to heat our homes and businesses, including heat pumps, so that the legislature is fully informed as to the pros and cons of different kinds of energy. Our request to this committee is that you expand the scope of this study to include health and safety metrics. The committee was very forward-thinking in including requirements in Section 10 of the Climate Policy Roadmap that plans for a low-carbon future address the societal impacts of air quality and diversification of energy sources. Expanding the study would be in line with the climate roadmap. Based on our literature review of the health impacts of hydrogen, we are particularly concerned with how blending hydrogen with natural gas will affect people's health and safety if it is piped into our homes for heating and cooking. We are also concerned that piped hydrogen will likely harm low-income and environmental justice communities the most. The health and safety implications of piped hydrogen for heating and cooking have not yet been examined for Massachusetts households. To give you some background, about 50% of households in the Commonwealth cook on natural gas stoves, and low-income households are less likely to have ventilation over those stoves to exhaust air pollution and more likely to rent, limiting their control over the type of stove and ventilation they have. Low-income households are also more likely to cook on older stoves, which have pilot lights. When burned, hydrogen emits much more nitrogen dioxide than natural gas alone. We are concerned that this will harm the 1 in 8 children with an existing asthma diagnosis and other vulnerable populations. Over the last decade, the medical community has come to better understand the health impacts of exposure to nitrogen dioxide. For example, just this year, the World Health Organization reduced by 75% its recommendations for annual exposure to outdoor nitrogen dioxide. Hydrogen ignites more easily than natural gas and can be ignited with a single spark. We would also like to better understand the safety of piping hydrogen into homes that cook with gas with pilot lights. Will these stoves be more likely to have unintended fires? To date, there are no studies of hydrogen on gas stoves with pilot lights. Lastly, we ask that the study consider emerging health harms like heat waves. As Massachusetts warms, air conditioning will be an increasingly important mechanism to protect people's health. Will our energy solutions address this important need for cooling? Thank you for considering our request to expand the scope of this study.